Okay, so the session will be recorded today, and as I mentioned, questions will be taken at the end of the session. So I'm going to make a start now and just welcome everybody to this session. Hopefully you're all here for the right one. It is the Multi-Agency Risk Assessment Conference session, which will be supported by colleagues from across the Surrey footprint. We are going to be talking about the MARAC process, talking about some of the services available to you to access. And again, any questions, any comments, please make sure you put those in there and hopefully get the best out of this 1 hour session. So I'm going to hand you over now to Sonia, who will go through the session and pass you over to the next speaker. Thank you.
Hey everyone, thanks for joining us. So I'm just going to do a quick round of introductions from the presenters. So my name is Sonia Knight. I'm the Domestic Abuse Programme Manager here at Surrey County Council, and I'm also one of the MARAC chairs. Dave?
Good morning, everybody. My name's Dave Thomas. I'm a Detective Inspector with Surrey Police, and yeah, I'm responsible for MARAC within Surrey Police and chair MARACs accordingly.
Thank you. Sarah?
Hi, I'm Sarah. I'm from Hourglass. I'm a community response officer, and I'm sort of responsible for Surrey, really. So I'm outreach, basically.
Thank you. Sheetal?
Hi, good afternoon, everyone. I'm Sheetal Goyal, and I'm one of the safeguarding advisors in Surrey County Council Adult Social Care. I cover Elmbridge Borough.
Thank you. And Barbara?
Hi everyone, I'm Barbara Savvy, Safeguarding Advisor for Reigate and Bouncy locality team that's part of Surrey County Council.
Okay, thank you. So in terms of our agenda, we've done our welcome and instructions. The first part of the session is going to be around what is MARAC. We've then got a presentation which actually I'm going to present on behalf of your sanctuary, which is around our specialist outreach services. Sarah is then going to speak about Hourglass and what is specific around that particular service. We've then got some adult case studies for cases that have been through the MARAC process and kind of what the benefits have been. And then there will be the opportunity for you to ask any questions. If you do need to pop any questions in the chat, I'll try and keep an eye on that as well. So that's the way the next hour is going to go. I'm going to introduce or hand you over to Dave, who is going to speak about MARAC.
Thanks very much, Sonia. Yeah, lovely to have this opportunity to speak to everybody today. I will try and keep this fairly brief and punchy because I can sort of talk about MARAC for a sort of 45 minutes to an hour, and I don't have that time today, so I shall sort of get cracking and assume that most of you would have heard of MARAC and know that it's got something to do with domestic abuse. It stands for Multi-Agency Risk Assessment Conference, and what it is, it's something that's it's not just a Surrey initiative, it's a national thing, so all police forces should be doing this activity in line with statutory agencies and non-statutory agencies, and it's a meeting, a multi-agency meeting, as the title would suggest, where we are focusing on how we can help those victims of domestic abuse, age 16 or over, at the very sort of highest risk, the sort of top end. I think Safe Lives, the DA charity, give a suggestion that it's kind of normally it's around the sort of top 10% of your sort of caseload, just as a ballpark estimation, but it's those sort of highest risk cases that we can bring a multi-agency approach to it and hopefully help minimise, or reduce, remove altogether if possible, the risk, and also offer assistance to try and prevent repeats and escalation. So that's kind of the gist of what MARAC is, and it's attended by various domestic abuse specialists and non-specialists in domestic abuse, but specialists within their own particular field. And what you find is that if you have that regular engagement and regular attendance, everybody within that meeting sort of becomes a little bit upskilled in other areas. I found out I'm never going to be fully across things like all the intricacies of housing and probation, etc. But I've got a bit more of awareness now, having sort of been chairing meetings for a couple of years, and you find that other agencies start to develop that sort of broader outlook and skill set just by attending the meeting. So it's good if you can attend, and if you can attend regularly. It's also worth pointing out the meeting is a confidential meeting. It's not something that we share outside of the meeting, and sometimes there will be exceptions to that. Court orders are normally the way to go with that. The ultimate and sort of the key part of the MARAC process, certainly in the meetings I chair, and I know Sonia's the same, is that we sort of try and focus on ensuring that we are identifying what those key points are that we need to do to help in each case. So we try to agree a bespoke action plan for each victim, and that isn't anything too wordy or in depth. It's kept purposefully simple and again punchy, so that everybody knows what they are doing, and can take those actions away without too much worry about excessive work and admin, and make things better really for those vulnerable victims. If I can have the next slide, please. So again, I've probably spoken around some of this already, but so that the aims of MARAC, obviously it's around increasing safety for the victims involved, and also looking at the wider family members. Sometimes that's children, sometimes that's other members within the family. Sometimes it's identifying other potential vulnerable people. It might be that somebody's got a new partner that we're discussing, in the sense of our victims might have a new partner, and we might just want to make sure that that new partner hasn't gravitated towards potentially a vulnerable victim. Sometimes it's on the other side of things, you might have a perpetrator who's in a new relationship, and we might look at exploring options around DVDS, the Clare's Law disclosures where appropriate. But the overall aim is around increasing safety for vulnerable people. Determining level of risk, I mean, by virtue of it being at MARAC, we are looking, like I say, at the high risk cases anyway. I've attended some MARACs in other forces where the chair makes a point of at the end of the discussion saying, oh, I'm designating this as high risk or medium risk or whatever it might be. That's not something that we do within Surrey. Not saying that we won't, but we tend to focus more on the circumstances and what practical actions that we can implement. And I think those forces that do determine the level of risk, it's because that then has a knock-on impact as to how that case is then progressed, whereas we are looking at sort of high risk cases. We certainly assess that risk, and if we feel that there is particular risk that is brought to that meeting that needs more urgent action and attention, then that is absolutely dealt with either at the meeting or immediately afterwards. So whilst we're not formally stating what that risk level is, we're kind of accepting that it's likely to be high by virtue of the fact it's here, and then we take appropriate action accordingly. In terms of reduction, we're looking at reducing, hopefully, repeat victimization, and reducing harm, reducing threat and risk to these vulnerable people, and improving outcomes for those those vulnerable people. And also sometimes we, like in the meeting I was in this morning, we're looking at improving potential outcomes for offenders, because ultimately that has a wider knock-on impact on the future behavior of that individual. If somebody's gone into prison and needs access to specialist support around drug, alcohol, mental health services, that's something that we try to ensure is being kept up or implemented when they're in prison, because sometimes we find that's the point where they drop out of services that they might have been having before they went inside, and it's making sure that those things happen. Also, in terms of improving, we're looking at improving agency accountability, having everybody attend these meetings on a regular basis, and having some sort of agency and input into the process. One of the other aims of MARAC is supporting the staff involved in high-risk domestic abuse cases. I mean, certainly within Surrey, that tends to fall more to the wider agencies to look at as part of their business as usual. But if there are particularly difficult cases where it's clear that is an issue or needs addressing, they'll be set as actions for the relevant agency. We look at continuing the development of best practice, and part of that is engagement. Sonia and I have a really good working relationship. I'm pleased to say, we're always sort of talking outside of the meetings and bouncing ideas off each other, but also we've got the more formal process of the steering group, so we can look at best practice there. And probably policy issues feeds into that as well, so that we can make sure that if there's appropriate learning or policy issues, that they're fed through the appropriate channels through MARAC. And then making sure that, focusing appropriate resources is really, again, as I kind of alluded to, having those action plans in place and making sure that the right people are doing the right things to try and get the right outcomes. If I can just take the next slide, please. Again, I'm not going to talk long on this. This just gives you an overview of the county, the breakdown of the of the different divisions within Surrey and the different geographical areas, and then how they're divvied up in terms of the MARAC discussions. So there are 6 MARAC meetings covering all of those different geographical areas, and each one of those 6 meetings takes place on a fortnightly basis. So hopefully I'm not confusing people too much, but essentially we have 3 meetings a week, and then the following week we have another 3 meetings, and then within that fortnight you've obviously covered your 6 MARAC meetings that are sort of listed on the left there. So you've got a meeting every 2 weeks. If I can take the next slide, and again, these 9 principles of an effective MARAC, I won't go into too much depth because I don't have the time really, but it's just to give you an idea of what, again, we've kind of, the aims of MARAC feed into these as well. So these are the 9 principles of an effective MARAC that Safe Lives have sort of set up as, again, it sort of helps to feed the sort of national practice and make sure there is consistency at each MARAC, that we're all working towards the same sort of standard around the recognition of what domestic abuse is, and certainly that's part of the workshop today. And I've been involved in similar training workshops with children's services, certainly, where we trying to raise that level of knowledge and understanding around high risk cases and MARAC, making sure that agencies are aware how to refer into MARAC. There's different, so that although we're talking about high risk being the key referring criteria, if you've got other criteria are also relevant. So you've got honour-based abuse, if a case is anything to do with HBA, it tends to come into MARAC as given. If we've got repeats, so if you've had a case that's come to your notice that has been at MARAC in the last 12 months, then that will come in regardless of the risk of that particular incident at the time. It's a repeat case, it comes in. And similarly, we have escalation criteria, certainly within Surrey Police, a certain number of cases, within a 12-month period, I think it's 5 within 12 months, that will, again, make sure that we're capturing those potentially lower level repeats that might be flying under the radar, make sure that they come into MARAC for a discussion to see if there's anything we can do. Certainly from my time in the major crime team, I know that sometimes it's actually those standard risk cases that are the ones that suddenly escalate into a homicide. So we need to make sure that we're looking at those as well. And as well as high risk, you've also got professional judgment, which is a really key criteria. So if you think a case is risky, but maybe the dash isn't indicating that it is, maybe that's because you're getting some minimization around some of the answers that you're being given. If there's anything that's troubling you about a case and you just think, what, this needs some sort of multi-agency engagement response to really help this, I'm not happy leaving it without that, then consider referring into MARAC under professional judgment as well. We talked about having multi-agency engagement. Obviously, that's the whole point of the meeting, and that's the advantage of it, and bringing people to bear from different sort of professional walks of life. The victims are offered the IDVA, normally through the outreach provider who represents their voice at MARAC. They're absolutely crucial, and again, it's why it's so important that as well as putting a referral into MARAC, you're also putting referrals into the relevant outreach support service, because sometimes we'll get to a MARAC, or we'll be approaching a MARAC meeting, and if the outreach service hasn't had that referral, then it's very difficult for them to explain what the victim's wishes are. I mean, we can certainly discuss the case without it, but it's much more beneficial if we've got that information. We've talked about information sharing, and that's all sort of covered by the information sharing protocols and MASPs that we have in place, but it's around making sure that information shared is relevant and proportionate. So, you know, we don't expect war and peace on these things. It's about really trying to focus particularly on the incident at hand, because that's what the point of the MARAC is. It's really looking at that high risk area. It's not, sometimes we take actions to set professionals meetings outside of MARAC where we think things need that little bit more lengthy engagement. We only get sort of 10-15 minutes per case normally to discuss a case, so we really do have to keep it quite tight and focused. And we've talked about action planning. I won't go into that again. That's the sort of reason that we're there. Ensuring that we're paying heed to equality and protected characteristics. Also feeding into operational support so that we're not setting unrealistic actions, and making sure that what we're doing is, I say, realistic and smart. And then, let's say, I've touched on governance already as part of the effectiveness going through the steering group. If we go to the next slide, please. Again, I think I've probably mentioned this already. So yeah, where I talked about HBA, that comes under harmful traditional practices. So as well as HBA, there's other ones there. There's forced marriage, there's FGM, there's others as well as those. You know, there's other cultural practices that would come under harmful traditional practices. Sometimes it's so-called black magic, voodoo, things like that, which we don't come across very often in Surrey, but being in some of the forces on our border do. So it's something to be aware of. We've talked about escalation, high risk repeats, and professional judgment. So yeah, particularly where that risk is escalating. So in terms of the meeting and the action planning, the way it works is normally the referring agency presents the case. Everybody else will have done some research and will feed into that case discussion, and that's sort of the chair's job to draw out of that the appropriate action that then follows, identifying those risks. And it's everybody's responsibility within that meeting to do that. So whilst the chair sort of sums up the actions at the end of the discussion, I really like those discussions where delegates there are volunteering actions, because they're, you're the experts in your particular field, so you will have ideas that other people won't necessarily have. And I'm really pleased that certainly the MARACs that I've been involved with in Surrey, that does happen. We don't tend to have too many tumbleweed moments. People are effective contributors. So for those of you that do engage with MARACs, thank you, and for those of you that will do, that's something to bear in mind. Okay, yeah, I think we probably have the next slide. Again, this is just sort of statistics, really. All I'll draw out of that is, as you can see, the vast majority of referrals come from police, but you'd probably expect that because they're the ones that are going out on a daily basis to calls of domestic abuse, and as a result putting those referrals in, closely followed by outreach, who are engaging with victims who are being referred into them. So they're the sort of the next biggest provider. In terms of adult social care, they're at sort of 33, as it's a third of the number of outreach referrals. So I don't know how that sort of sits with your caseloads. Certainly, we'd be happy to see that number go up if appropriate, though. Let's take the next slide. And attendance, again, you can see there, adult social care, these are sort of broken down into the various different MARACs. So for example, Epsom or Valley Tandridge, we've got adult social care there at the same number of meetings that we've got everybody else. Where they're perhaps dropping off, Spelthorne, although having said that, I chaired Spelthorne today, and really pleased to see that we've got adult representation there today, and they said that they're going to hopefully be there sort of moving forward, so that's been addressed. But yeah, it's just about trying to make sure that we've got that consistency of approach across all the relevant MARACs, and that we do have your representation. Next slide, please. Again, I won't go too much into this, but it's just really highlighting the fact that the work that you are doing within adult social care is going to feature prominently within MARAC, because a lot of the concerns that you come across, particularly around mental health, substance misuse, will be, part and parcel and sort of bread and butter of the work that you are doing. It does say on there that cases where the individual has additional care and support needs has fallen slightly in the previous 6 months, but that is just a snapshot, and obviously we'll keep an eye on that through steering group to see if that's a trend or not. Thank you. And then these are just some frequently asked questions. So in terms of consent, yes, it's always advisable to get consent from the person that you're referring into MARAC, because you tend to get more effective engagement. But the point is that we're dealing with those really high risk cases, so it's not absolutely necessary to get their consent. And I've sort of doubled down there on, if you're referring to MARAC, then please make sure you're referring to outreach too. Some referral quality varies, from MARAC to MARAC and agency to agency and individual to individual within those agencies. But ultimately, what we need is an explanation as to why that referral is coming in, why why it's high risk, or under what criteria you really feel that's coming in under, and crucially, what support's required, because that gives the chair a bit of a head start in terms of where we can sort of focus the conversation and try and get some meaningful actions. If people are reporting criminal offences to you, then please report those via 101, or if it's an emergency, 999. Please don't think that by reporting it to MARAC that it's necessarily going to get the police response that it deserves, because there will, by the way the system works, there will be a time delay before that coming to anyone's notice. So please report criminal activity to 101. And then after MARAC, it's normally the IDVA gives some feedback to the survivor as to some of the flavour of the discussion and what was agreed, and then also if other actions are set where that engagement is required, then that will be done as well. And then administratively, the minutes get uploaded onto Modus and are shared with attendees. I think that's probably that's the next outreach are on next. So I'll take questions at the end. I'll stick around, but thank you very much for your time. I hope I didn't overrun too much.
Thanks, Dave. That was fab. Okay, so I'm going to speak to outreach. So Dave made reference to outreach support throughout the presentation there, and it is really important to have that outreach presentation, that independent voice of the victim at the meeting, because it's really important that we know actually what are the concerns, what are the real issues and the real risks as far as the victim is concerned. So as professionals, we can think, okay, so housing may be the major issue, but actually what are the key issues for the victim, and is there anything specifically that would help in terms of their journey? So I'm going to speak on behalf of, this is a presentation done by Your Sanctuary, but in Surrey we have 4 outreach providers. They are a consortium which come under the lead provider of ESTAS, East Surrey Domestic Abuse Service. So you have ESTAS, you have North Surrey Domestic Abuse Service, Southwest Surrey Domestic Abuse Service, and Your Sanctuary. They're all commissioned under the same sort of specification, if you like, and contract. So there should be and is consistency across the county with the type of support that you would receive from any of those services. So in terms of outreach support, what outreach can do is they will offer emotional and practical support to the adult victim of domestic abuse, and will also have contact with, if required, and support the children of those adult victims. They will get a really good sense of what the issues are, and signpost to any other relevant agencies. So no single agency can really support effectively a victim of domestic abuse. There are lots of agencies involved, so they would always signpost onto other specialist services if that was required. Safety planning is key. Victims of domestic abuse don't always want to leave an abusive relationship, or indeed if they do, it's really important that we manage the safety in the home, in the community, all of those sorts of things. So safety planning is absolutely key to the role of a outreach support. So advocacy, so they will provide advocacy in court, in criminal court. We're doing some work around family court at the moment because that is a really big issue and gap currently for victims of domestic abuse. They'll attend social care meetings, they will attend MARACs, for example. So really, if there's any situation the victim is going into where they would require some support, if it's housing, anything like that, the outreach service would support with that. We've already spoken to the survivors' voice at MARAC, and they will update the victim of any discussion at MARAC, not detail, obviously. It's got to be discussion that is relevant to them and their children, and any action. So if somebody's suddenly gonna make a phone call to them, they know to expect that phone call and what that might be about, for example. This is around the identifying abuse. So there's no one size fits all, obviously, with domestic abuse. Professional curiosity and assertiveness is really, really important and really, really key. Speaking to the service user away from family members, for example, or away from the partner, and just bearing in mind that, as you will all know, domestic abuse is not just limited to intimate partners, it can include family members. So it's just, you know, making sure you give somebody the space and the opportunity to raise any concerns or to disclose if they wanted to. Patterns of behaviour are often key. So if you're noticing certain patterns, that may be an identifying sign. Risk assessment. So the risk assessment we use in Surrey is the DASH risk assessment. So that stands for Domestic Abuse, Stalking, Harassment, Non-Based Violence. It's a national domestic abuse risk assessment tool, and that way we get a really good common understanding of the level of risk across lots and lots of agencies. A DASH risk assessment does not have to be completed by a domestic abuse specialist. Any professional, anyone can complete a DASH risk assessment. There's some really, really good guidelines on Safe Lives. So they have the risk assessment and some really, really good guidelines around how to frame the questions, you know, what sort of information we might be trying to pull out of those risk assessments. So any professional can complete a risk assessment. And even if the risk assessment is not shown as high risk, for example, so we use the number of 14 ticks would indicate high risk and therefore a referral must be made to MARAC. If you got a risk assessment score of 6, for example, but actually you felt, I think there's some minimisation going on here. Actually, I'm really concerned. There's been recent separation. There's a pregnancy. There's recent injuries. You know, there may be some of those questions that have just really raised concern. So you can absolutely, if you feel that that case is high risk, make a referral on professional judgment, and that case will absolutely go through the process and be discussed at MARAC. And then we've just got some information here. So there's the Surrey helpline for advice. We've got some new anti-victim blaming guidance, which is going to come alongside some training as well. That will be available for any professional to book onto very, very soon. So I'd recommend that any professional book onto that. And we've also got a link there to the gold standard coercive and control behaviour framework, which just gives some guidelines around particular ways to work around domestic abuse. We will send these slides out, so you will be able to access those. Some of our high risk indicators, absolutely fear of the survivor. The survivor's fear will be very real and very consistent for them. The alleged perpetrator and survivor mental health. So we see that a lot with our MARAC cases where mental health is an issue for both the perpetrator and the survivor, or either or. Recent separations. So the majority of domestic homicides occur in the year post separation. So the most dangerous time for a victim of domestic abuse is at that point of separation. So that is a real high risk indicator if somebody has just left an abusive relationship. It's not that that risk is reduced. Actually, very often the perpetrator can step up that controlling behaviour, and that can be a really dangerous time. Stalking, is something we see very, very frequently with domestic abuse cases. Pregnancy, again, pregnancy is often not the causal factor of domestic abuse. There would generally have been elements of domestic abuse prior to a pregnancy, but you can often see domestic abuse, particularly the physical, escalate during pregnancy. So that again is something to keep an eye out for. Weapons, threats to kill, non-fatal strangulation. So again, something we see at a huge amount of our MARAC cases, where there is non-fatal strangulation. Sexual abuse, if there's previous criminal histories, including violence. Huge links with mistreating of animals. So again, something to bear in mind if you become aware of any mistreating of animals. Substance misuse, again, could be for the alleged perpetrator or for the victim. You know, it could be a coping mechanism. It could be a way that the perpetrator is controlling the victim by being their sole supplier, for example, making them dependent on alcohol, substance misuses. Threats of suicide by the perpetrator. And again, I said to this earlier, the survivor mental health. So if high risk abuse is identified, clients should be referred to both outreach and MARAC. Okay. Why is multi-agency working between adult social care outreach and MARAC so important? So the abuse may have only been disclosed to one service. So what we often hear is we've made a referral to outreach, therefore they would have made the referral to MARAC. It may be that outreach weren't able to make contact. It may be that the risk assessment, the information that is provided by the survivor is different, therefore it doesn't come across as high risk. So it's really important that each individual professional takes responsibility of making that referral into MARAC and sharing that information if there are professional concerns. The lesser known indicators of abuse may be missed. And very often survivors of or victims of domestic abuse, you know, don't realise that actually what they're experiencing is domestic abuse. It's only when you put everything together that you realise actually how risky that situation is. Identifying perpetrators' behaviours, that is a key part of MARAC. So we talk about the perpetrator as well. It's really important around safety to staff, for example, if there are risks around weapons, if there are bail conditions. Not all the professionals may be aware of those bail conditions. So if you're doing a home visit and the perpetrator's there, and there shouldn't be. So there's lots and lots of information there. Opportunities to raise safeguarding concerns can be missed. Not everybody has the expertise around the table to identify care and support needs, or actually where there may be a particular vulnerability. So that's really important. The appropriate level of support or intervention, especially mental health support. Informed decision making, so really understanding who is best placed to work on particular risks, virtual engagement, all of those sorts of things, and supporting survivors who are neurodiverse. So that multi-agency view is really, really important, and it's just as beneficial for the agencies attending. So if you're managing a case and it goes to MARAC, you can also get a huge amount of information back to support the work that you're doing, as well as the information you're feeding into that process. So it's a really, really important part of process. It is very much a two-way process. Okay, that's the end of outreach. We'll have questions at the end. I'm going to pass over to Sarah to speak about Hourglass.
Yeah, thank you. Thanks, Sonia. So Hourglass, we kind of, we're an outreach service, although we're not one of the main ones you would refer into necessarily. So if it's a high risk case, they tend to go to the 4 main providers, as explained earlier. So just a little bit of information really about how Hourglass fits in with that offer of service in Surrey. So we work only with people who are over 60, and the reason that we're kind of here really is because we know that the characteristics of the victim survivors and the perpetrators with that age group are a little bit different to how you would sort of conventionally see domestic abuse. So actually, just even with the proportion of male clients that we work with, there's a much greater proportion of male clients. and they aren't perpetrators, they are victims in their own right. So basically our client base are they're more likely to be experiencing adult family member abuse. So we see a lot of people with adult children still living in the family home that are perpetrating abuse to their parents, who are obviously now getting older and more frail and health-wise declining as well over time. I think statistically from our helpline stats, the biggest proportion of perpetrators we have are adult male children living within the family home. So our client base is clients tend to stay living at home. So even when they're being helped by outreach, they tend to stay, they don't tend to leave. Also, the abuse tends to happen within the family home as well, very, very high proportion. In fact, most of our client base abuse happens there. And also they tend to stay, the perpetrators tends to stay because they're so often an adult family member. Even if you're providing outreach support, the abuse continues because they're just living with the perpetrator full time. Also, as people age, obviously we get disability increases. You've got the instances of dementia as well, which is worth mentioning. We can get perpetrators with dementia. We can get clients with dementia. So the only other thing really to mention is that the greatest proportion of the type of abuse that we experience is financial abuse. So very often it's linked to the family inheritance that's coming. So there's a lot of sort of gatekeeping of services that the adult child within the family home is trying to prevent the spending of money to access services to keep their parents living in the family home. They might need a gardener or a paid care, that sort of thing. So there's a lot of neglect as well. So yeah, that's it really. I mean, just to say that we do take direct referrals. Anything high risk obviously goes via the police or the other 4 providers, but you can send referrals straight into us, which we do get. Our helpline is available 24/7, so anyone can call that. Clients, professionals, if you're not sure how to deal with the situation, then call our helpline, which is the number at the top. And that's really a very brief synopsis of us.
Thank you very much. Okay, we are now going to go over to Sheetal. Sheetal's got 2 case studies to share with you. So Sheetal, over to you.
Thank you, Sonia. Hi, everyone. So as I said, I'm from Ambridge locality team, and I'm going to share about one of the cases we had at MARAC. All names have been changed to protect the identity of our clients. So I'm going to talk about this case, Libby, and she lives in a 3-bedroom PA housing owned property. She's 56 years old. She has a diagnosis of emotionally unstable personality disorder and hip joint issues. She had called the police as a result of assault from her partner, Joe. And police attended the property, and he was arrested, and then Joe was released with bail conditions to not contact Libby for the next 28 days. However, Libby was eventually, she was not engaging in the police investigation. She was not willing to make a statement, and so the case was filed. We as an adult social care team received a SCARF report saying that this incident had happened and that she has hip joint issues and that she may possibly need care and support. We called her we instigated a Section 42 inquiry as the criteria were met. And we gave Libby a call and we discussed the situation with her. She said she's doing fine. She's on a waiting list for a hip replacement surgery, but she's managing fine, and that she didn't want any support from us. And, because there was no reason to doubt her mental capacity to make a decision about her care and support or about domestic abuse. She said she was not here. She had broken up with Joe and that she hadn't heard from him since the incident and that she's not going to allow him back to her property. We felt she was able to support herself and were about to conclude the Section 42 inquiry. But we kind of left it open pending discussion at the MARAC. Now, at the MARAC, we were able to join all the dots together. Outreach shared that she wasn't engaging with them and she said she was doing fine. We learned from PA Housing that she was in, she had accumulated a debt due to non-payment of rent because her housing benefits were only for a single-room property, whereas she was living in a 3-bed property. We identified that she was potentially minimizing the issue. Then we gathered that she was not engaging with professionals and she was shutting everyone down. So we agreed at the MARAC that that there are, the risks are higher than they appear to be. And we agreed that the lead inquiry officer for the Section 42 inquiry and PA Housing would do a joint visit. And we also identified that she was a bit concerned about the breaking in of the door by the police, and we felt that that was perhaps a point that we could use to get a foot into the door. It was a lot of perseverance from our side because she would, every time we left a message or every time we booked a visit, she would cancel it or she would not answer the door. But eventually we were able to get in and we addressed her concerns about the door, the security of the door. We identified that she's been in an on-off relationship for the past 10 years with Joe, and there is a likelihood that she will let him in the near future. So we discussed a silent solution system. We were able to complete a Section 9 Care Act assessment as a result of persevering. So the positive outcome for us in this case was being able to get a better picture of the case at the MARAC. We were able to join the dots, and then we agreed to work on the case further jointly with PA Housing. That helped her get connected to different professionals. We signposted her. We developed a relationship. So, in the future, if it came back, we knew there was a point of contact for her within our team. So for me, this is the reason why this is a positive case of, joint working as a result of risks identified at MARAC. We also have another case. Now, this was shared by one of the student social workers who was in the Waverley locality team. So this is not really my case, but I'm going to, read this out. The student social worker has said that there was this case where a person was trying to flee domestic abuse, and it was discussed at the MARAC. A location of interest marker was put in by the police. But at the MARAC, there was discussion that the police were not able to take any further action, due to the lack of evidence. However, professionals got together and they were able to help her find a new home. And that was fitting in with her disabilities. So again, this was another case of joint working as a result of information sharing that was done at MARAC and to achieve a positive outcome for the client. That's all from me. Thank you.
Thanks, Sheetal. Okay, and finally, we will go over to Barbara, and then we'll have the opportunity for some questions. Barbara.
Thank you, Sonia. I'm going to run through this case, which was a Reigate and Banstead locality case and a real case, and with a very good outcome, I'm very pleased to say. Obviously, the names have been anonymised. So it's Mr. and Mrs. Smith, well known to MARAC as a high-risk repeat case. They were both older couple in their early 60s, in their late 60s, early 70s. Mrs. Smith was very afraid of her husband, and she had shared that with a number of colleagues. However, she was not prepared to leave the marriage. She'd placated him over the years to try and keep the situation as stable for herself as possible, which is not entirely satisfactory. He monitored everything she did. He asked questions about where she was and what she was doing, to the level and degree that we put it within coercive control. It was managed over a period of time through MARAC. Police were always called to the property because often there was concerns about her safety. He was arrested several times, but always went home. There were bail conditions in place, but he breached every time. And unfortunately, Mrs. Smith did not always report those occasions. Mrs. Smith had allowed him home afterwards against everyone, all the professionals' advice, and she was offered alternative accommodation. However, she didn't agree to that. I think that her fear was the main issue in this situation. She would not consider leaving him despite efforts from Adult Social Care, ESTAS and MARAC agencies to try and persuade her to look at the alternatives. She was a carer under the Care Act definition. Mrs. Smith had depression and anxiety mainly due to the domestic violence, and this was managed by her GP, and she had medication. There were assessments conducted both by Adult Social Care within the Section 42 inquiry. There were a number of DASH risk assessments completed by both ESTAS and police at the time, and it all indicated a high level of risk. So there were real concerns for this lady's safety. Then Mr. Smith was admitted to hospital. Now, this was a window of opportunities. They don't happen very often, but this was a blessing in disguise for all of our agencies. So we were able then to go into the property, have proper conversations with her, both Adult Social Care and ESTAS, and to talk to her about her options, what she could do and what was available. She was in agreement to consider those options, and unfortunately, Mr. Smith's health deteriorated to such a degree that we had to arrange a short-term respite for him, which was a good thing. So that allowed us a little bit more time to work with housing and other agencies to look at the options. Once Mrs. Smith had realised the degree of distress and anxiety that she was living under, and it was a long-term situation, she decided to work with us, and the locks were changed at her property. Door bolts were in place, and domestic violence, domestic abuse kits were given to her as a precaution, as agencies were concerned that he could leave the respite and make his way home. So that was our biggest concern. That didn't happen because his health then deteriorated along with his mobility, along with his capacity. So then he was actually put into a full-term residential care. So all in all, this took many attempts to engage her. So if you can take one thing away from today, is please don't think that one attempt, it's numerous attempts and numerous discussions in MARAC actually moved things forward. She then could live out the rest of her life in some peace and safety, which is really good news. So it was a very successful outcome for all concerned. Thank you, Sonia. Over to you.
Thank you. Okay, we've now got the opportunity for any questions, and while there are questions, I've also got just some contact details there. So I spoke about the outreach providers. We've got the Surrey helpline, obviously in an emergency to dial the police. There's a 24-hour helpline there as well. So I'm just going to leave those on the screen for you, and obviously you'll have access to those when we send the presentation out as well. So any questions?
Sonia, I'm just going to add the website as well. So the Safeguarding Adult Board website, where we've got the other webinars also,
Yeah,
so that people can access those.
Okay, so it doesn't look like we've got any questions.
Is there anything in the chat at all? Anything?
I think I dealt with everything in the chat. So I've also put in the chat a link to the DASH risk assessment that I made reference to. In order to make a referral into MARAC, we've got an online referral form, and you can access that on the Healthy Surrey website. So I've also put a link to that there. If anyone wants the opportunity to come and observe a MARAC, we can absolutely facilitate that. If you want to see what it's all about. We can only have, we don't like too many observers, but if you would like to, then you can contact the Surrey MARAC email address, and we will arrange that for you. So I'm just putting the Surrey email address in the chat. There you go. Okay, so if nobody has any questions, oh, Claire. Are they able to come off mute?
I'm just about to say you may need to put it in the chat.
I've just got to go into options.
Okay, thank you.
So just while Dana's doing that, I'd just like to take the opportunity to thank you guys for delivering that. It was really good, and it was really informative. And again, if anyone wants to put any comments in the chat, please do so, because everybody's really busy and they've taken time out today to deliver this session. So great.
Oh, Claire's saying she's blocked from coming off mute. Claire, do you want to pop your question in the chat and then I can speak to the answer?
Sonia, that should all be going through now because it's been saved, and I can see that some of them have come off mute. So
okay, fab. I think the question was, just wanted to ask about consent for referring to ESTAS. So if it's around a MARAC referral, so if you've made the MARAC referral and the victim knows you've made the MARAC referral, which, if you're able to have that discussion, then that's great. If you're not, then that's also fine. You don't have to have consent to refer to outreach. They do like to have consent, but if it's regarding MARAC, they will make contact with the victim prior to the MARAC meeting anyway. Does that answer your question, Claire? Does someone not engage in MARAC referral has been done? I haven't been able to tell her. No. I mean, that's fine. It's not always off, it's not always an option to if somebody disengages, for example, but you've made the MARAC referral, so just make the referral to outreach anyway, and they will attempt to make contact. If nobody's able to make contact, we'll discuss it at MARAC, and we'll be thinking about creative ways in which to engage, hopefully identify any other professionals that are involved, so that's fine. Thanks, Claire. Is there a list of abbreviations available, especially for the police, that the police are using in the meetings? there probably are a list of abbreviations somewhere. I'll have a look. I know that we've got one on the needs assessment actually, so I'll see if I can pull that out and send that to Jolie.
Was there anything on that we've, like, sometimes I can be guilty of slipping into police jargon, especially if I'm sort of rushing through something, as I may have done today. Was there anything particular that I referenced that wasn't clear, Ralph? Type in the chat if there is, and if I can help, I will. LOI, yeah. So the DVDS is the Clare's Law. That's Domestic Violence Disclosure Scheme. LOI is a location of interest marker, but sometimes they're called different things depending on which force they are. So the Met's version would be sort of special schemes. So you might see SS marker. But yeah, the trouble is they evolve and they change as well, and the police are notorious for doing it. And if I'm chairing a meeting and somebody uses an abbreviation, I do try and clarify what that is during the meeting. But yeah, if there's anything that you need some additional help with, oh look, there's a long list of them there. Thank you.
Wow, well done, Sheetal.
Oh, Sheetal's put this in. But yeah, there'll be more.
What does a DA kit consist of, Dave?
Hand grenades, the usual. No, it's normally it's a door brace and some window locks. Now, they're not foolproof things that will, give permanent prevention to somebody determined to gain access to a property. They're designed to give a little bit extra time to allow somebody to escape a determined perpetrator trying to gain access, and they don't always fit every eventuality. So sometimes I think the point of the door brace is that they're designed to work, by preventing a door handle from coming down and engaging the lock that way. And I don't think there's other door kits available within Surrey. But if we get that as an issue, we tend to sort of go back to the domestic abuse team and just say, look, can you explore whether there's anything that can be done a bit more bespoke on this? But it's also on DA kits, just 2 points really. One is again, we have to be quite careful when we're distributing them because, well, we shouldn't be distributing DA kits where we feel that there's a perpetrator in the property, or risk that the perpetrator might be allowed in the property, because then it can be used against the victim and it can actually delay the help that emergency services would be trying to provide to that victim. And the other point I was going to make on those is, what was I going to say? Yeah, it's around the same sort of point around, oh yes, and just it's a bit boring, but it's budgetary. We used to give them out a lot more often than we do now. We really have to be, they're focused on those very high risk cases, because often what we find is that we give the kits out and then we never see them again. There are so many DA kits out there that probably don't need to be out there. The survivor's moved on with their life and doesn't actually require that kit, but doesn't normally think to give it back. Actions that often come up in MARAC are to review whether DA kits are still strictly necessary. Sometimes it's because we feel the perpetrator's there, or sometimes it's because we just don't feel that need is met. But yeah, so that's what it is. It's essentially a door brace and some basic window locks, but they're not to be relied upon. They're just to buy time.
Okay, Sheetal.
Thanks, Sonia. Sorry, I have a question for Hourglass, Sarah. I remember it came up in one of our cases, that we wanted to refer a client, but they're hard of hearing and they obviously wouldn't be able to speak on the phone, or not the best mode of communication. So do you do any face-to-face visits?
Yes, we do. We tend to work by telephone, which most outreach services do anyway, but yes, we do. I've been speaking to a lady who's deaf and she can only lip read, so I've been visiting her. So yeah.
All right, lovely. Thank you.
Okay, that's us out of time. So I think we've answered all the questions in the chat. So thank you all very much for your time, and we will get the slides sent out to you.
Thank you.
Thanks, everybody.
Thanks,
Thanks, everybody.
Thank you.
Bye-bye.
Bye-bye. Bye.
Thank you.